Hi, my name is Mariam Shodro. I'm going to do the health assessment video head to toe, and here is my mom, my patient. Her English is not very well, but she's gonna help me, and here's my sister. She's gonna take the video. Here's my equipment, and here is where I'm going to do the video. Thank you. Okay, I wash my hands before entering the room. I also use alcohol wipes to clean the stethoscope. Hi, Mrs. Mary, how are you?
Good, thank you.
I'm Mariam Shodro. I'm your nurse today.
Yes.
Can I see your ID badge? Okay. Would you please tell me your name and date of birth?
My name is Mehri Puran Haji, April 1970.
That is great. Let me provide some privacy for you. Are you comfortable here?
Yes.
Do you need to go to washroom?
No.
Okay. Okay, Mrs. Mary, I'm going to touch you at some point for the health assessment. It's okay. Thank you so much. So, my patient appears her stated age. Her skin is intact and moist, and the hygiene is good. There is no odor. She is well dressed according to the setting and grooming. The height and the weight is also appropriate for her age, and she's well nourished. I can see that the body position is erect, and she is sitting relaxed, and in the sitting position is bilateral, and also she behaves very well. The facial expression is there. She has a good mood, and she speaks fluent and accurate. Can you tell me who are you?
Mehri Puran Haji.
Okay. Where are we?
The hospital. In the hospital.
Okay. What day is today?
Monday.
Okay, so she's alert and oriented to the time, place, and person. Would you please walk for me?
Yes.
Thank you. Okay. So she's her gait is as wide as the shoulder. She walks well balanced and is smooth. At the same time, I can say that the range of motion is fully, because she can walk with the whole joints are moving fully. That's great. So now I go to the head. For the head, I see that the head is normocephalic, is in the midline of the body, and it's symmetric. It is round. There is no lesion, no scars. So I touch you. Do you have any pain?
No.
No pain, no tenderness. There is no lump. There is no lesion, no scars. The hair is distributed evenly. There is no dandruff. The hygiene is good. The texture is good. The texture is smooth, and okay, that's great. So now I go to the face. Now what I see about the face is symmetric. There is no lesion. There is no scar. There is no deformities or tics, or it is warm to touch. And would you please smile, frown like this? Okay, lift your eyebrows. Lift your eyebrows. Like this. Very good. Close your eyes and don't let me to open your eyes. Close your eyes. Close. Thank you. Puff your cheeks. Okay, that's great. So cranial number 7, which is the facial, is intact. And okay, so now I go to the eyes. What I see is that the eyebrows are distributed evenly, bilaterally, is equal, and is symmetric. And can I see your eyelids? The eyelids, there's no lid-like, there is no swelling. There is no strobimus. There is no drainage. Would you please look up? Look up. Conjunctiva is pink and nice. Sclera is white and shiny. There is no drainage. And okay. And the eyes are equally symmetric. So now I would like to do an optic test. For an optic test, can you read this line for me?
Right. Left.
Okay.
Up.
Okay.
Down.
Can you write this? Can you read this?
M. N. O.
Okay, that's great. So your optic is 20/20, and for okay, confrontation. For confrontation, I would sit in front of my patient, and I would imagine that there is a wall here. Would you please block one of your? Would you please block one of your eye? Thank you. And when you see my finger, just say now. Look at me. Look at me.
Yes.
When you see my finger, say now.
Now. Now. Now. Now.
Okay, and the other one?
Now. Now.
Just
now.
look at me.
now.
Okay, so the confrontation is intact. And now I would like to do, with my pen light, I would like to do the accommodation test for the constriction of the pupils and the dilation. Would you please look at the object on the wall? Okay, and I bring the light. Just look at the object. Okay. Okay, so I can say that it constrict between the pupil is 4 millimeters and it constrict from 4 to 3, and it is reactive to the light. So now just look at the object there and look at the pen, follow the pen. Okay, so it's also responsive to the accommodation. So the pupils are round, are equal, round, responsive, reactive to the light and accommodation, parallel. And that is cranial number 2, and that is also for the extra oculomotor. Cranial number 3, I also do the cardinal gaze 6. So just follow the pen light without changing, without moving your head. Thank you. That is great. That is intact as well. Okay, now we do the ears. For the ears, what I see is that the ears are bilaterally equal, symmetric. There is no edema, there is no swelling, there is no thickness. And I touch the tragus, auricle, pinna, and mastoid. Do you have any pain?
No.
No pain, no tenderness. And I would like to do a whisper test. Would you please? Okay, so I say 3 words. Repeat.
Yes.
Thank you.
Classmate, classroom, basketball,
Thank you.
volleyball, football, tennis room.
Yes, that's good. Okay, so the hearing is equal at the both ears. So I would like to do a Weber test. For Weber test, just when you feel the ringing, just tell me that you feel it equally, when you hear it in the both ears.
Yes, yes.
Okay. Now I do the Rhine test. For the Rhine test is the air conduction and also the bone conduction. When you don't hear it, say now.
No. No.
Now.
Now. Now. Now.
Okay, so that was the Rhine test, which shows that the air conduction is longer than bone conduction, which is good. Okay, now for the ear, I also use the otoscope to check the external auditory canal, and I get pinna up and out, and I look inside. What I see is that it is moist and there's no erosion. Tympanic membrane is gray, pearly, and there is no bulging, there is no tenderness, there is no odor, there is no discharge. Okay, and I do the same for the other ear. I just don't do it now. And so we did the whisper test, and we can say that also the cranial number 8 is intact. Okay, and that was the ears. And so what we do now is for the nose. I see the nose, it is a bilateral, symmetric, and I would like to check inside. So please just sit, no, just the nose. Tilt your head up. Okay, I see the turbinates are moist and pink. Sputum is in the midline. There is no perforation. There is no deviation. There is no nostril polyps, and there is no discharge or foul odor. And would you please block one of your nostrils and sniff? Okay, the other one. Okay, the patency is good. Will you please close your eyes? Close your eyes. Close your eyes, and tell me what you smell.
Coffee.
Okay, that's great. So the patency and the smell is intact. Okay, now I would like to touch your sinuses. I touch the frontal sinuses. Do you have any pain?
No.
Okay, and the
No.
okay. So there is no pain, no and no tenderness. Okay, And that was for the nose and sinuses. So okay, so that I can say also that cranial number 1 is intact, olfactory. And now I would like to check the mouth. So I see the lips, there is no cyanosis, there is no cracks, it is moist, it is symmetric, there is no tics, or there is no disformation. Yeah. So would you please say E?
E.
Yeah, I see that the teeth are white and nice, there is no dental caries, the gums is pink, there is no bleeding. Would you please say A?
A.
Okay, the uvula is in the midline. It arises with the subpalate. The subpalate is a bit wide, but the subpalate is pink and moist and nice. Would you please stick your tongue out? Okay, I see that there is no thrush, there is no tremors, there is no deformation. Or would you please do like this? Okay, thank you. Would you please say light,
Light.
tight,
Tight.
dynamite,
Dynamic.
dynamite,
Dynamic.
might. Okay, that's good. So I can say that the cranial number 9, 10, and 12 is intact. Okay, that's great for now. And okay, thank you. So I go to the neck. For the neck, I don't see any deformation. The trachea is in the midline. There's no lesion. There is no scar, and there is no thyroid enlargement and no masses. And I also palpate the carotid artery. The carotid artery between the sternobastid and trachea is very strong. Is hollow. Is +3, irregular, and equal at the both sides. Okay. Now I would like to check your upper extremities. For upper extremities, I don't see any lesion, I don't see any deformities, the skeletal deformities. There is no weakness, and there is no lesion. Do you have any pain?
No.
Okay, no pain, no tenderness. Can I touch you? Thank you. And on the joint, I don't see any swelling. I don't see, it is warm, it is not cold or hot to touch. The skin is intact, it is moist, there's no scars. The nails are round and nice. The angle is 160. The capillary refill is less than 2 seconds, which is good. Okay, that's great. And for the upper extremities, what I would like to do also is, before that, I check the radial pulse, and I also check my watch. So the radial pulse in 1 minute is 63, is +2. It is strong and regular in rhythm, and it is equal. Would you please grab my hands? Okay, the grip is very strong and nice. Okay, now would you please stand up? Okay, for the thorax, I see the anterior, posterior, and transverse is 1 to 2, which is good. And okay, now would you please do the extension? Flexion, extension, hyperextension, like this. Very good. Abduction, abduction, and adduction, adduction. Like this. Thank you. And external rotation, internal rotation is 90, 90, very nice. And for the elbow, flexion and extension, which is 0, flexion 90, nice. For the wrist, flexion, extension, okay. And if you hold it like this, pronation, supination. Okay, if you hold it like this, radial deviation, ulnar deviation. Very good. For the fingers, flex, flex, extend. Okay, that's great. I can say that the range of motion is good and is intact. Thank you so much. You can actually sit here. Yes, just sit here. Now I would like to do the lower extremities. The lower extremities is also in, there's no deformation, there is no, I don't see any lesion, no scars. Do you have any pain?
No.
No, there's no pain, no tenderness. I check the dorsalis pedis pulse. The dorsalis pedis pulse is equal, is strong, and is present. I also check the posterior tibialis pulse. Posterior tibialis pulse is present, is strong, and is equal. Okay, now dorsiflexion, just flex, plantar flexion. Okay, for the strength, just press my hands, very good. So it is equal, strong, and present, and I wash my hands. I remember that I asked you to walk, but would you please walk again for me? If I have, okay, missed that. Thank you so much. So the gait is good, is well balanced, and as wide as the shoulder, and the range of motion is very good, and it is fully. Okay, now I would like to do this thorax, but posterior. So would you please sit here for me? Thank you so much. So the posterior thorax, I don't see any deformities, I don't see any lesion, any scars, and I don't see any accessory muscle use. I don't see any respiratory distress here. Okay, do you have any pain?
No.
No pain, no tenderness. I also say it about anterior, posterior to the transverse. Okay, now I palpate. I don't see any masses. I don't see any lumps and any lesion, no pain, no tenderness. Now I percuss. I start with the apex of the lungs, and I go to the intercostal. What is important here is the resonance. To hear the resonance, and we only can hear that. Okay, so the percussion was good. Now I do the auscultation. For the auscultation, I also start with the apex. Please take a deep breath. Just a second. Just take a deep breath. Okay, so there is no wheezes, there is no crackles, there is no bruise, and it is the bronchialis is louder, and the vesicular is lower pitch. Bronchosvascularis is medium pitch, and there's no bruit and no crackles, no wheezes, and the air entries in all the lobes are equal and bilateral. Okay, for the anterior, I also check the respiration in just sit down, and I also check it with my watch for 1 minute. Okay, so it is 18, and it is regular, it is relaxed, and there is no the respiration, the rhythm is regular, and it's good. Okay, now I do the cardiovascular. For the cardiovascular, I have to check 5 points, which is I see the sternal nudge, go to angle Lewis, go to the right, it is intercostal 2, it is aorta, and aortic area, I check for lambda S1, S2, and then I go to pulmonic area, and then I go to Erb's point, and tricuspid, and mitral, which is in the mid clavicle. Okay, I'm going to check for the height. I also can check the apical pulse there. So S1, S2, locked up here is S1 is lower than S2, and as well here S1 lower than S2, but here in the tricuspid and mitral the S2 S1 is louder than S2, and for the apical I also check and it is 63 and it is regular and good. Okay, now yes. Okay, and I also with the bell of my otoscope, stethoscope, I can check for murmur S3 and S4. I didn't hear any murmur or S3 or S4. Can you please thank you. Okay, now okay. So now I check for the abdomen. I would undrape it, but here because my patient, I would like to keep that like this. For the abdomen, I check the. First I inspect. There is no distension. There is no hematoma. The umbilical is in the midline, and there is no sign of discharge or discoloration or hernia, and there is no stretch marks as if it was undraped. Okay, now I percuss for the, I auscultate. I don't percuss, I auscultate. And I do that with the lower right quadrant and upper right quadrant, as well as left lower and upper. Okay, what I hear is the clicks and gurgling, which is a normal active bowel movement, and which is nice and good. Okay, now I also auscultate for the aortic, for the vascular. So I listen to aortic and upper renal, right and left, upper renal, as well as iliac and femoral, right and left. So I check aortic, renal, super. And this is good as well. Okay, now I percuss. It is tympanic, and that shows that there is no masses, there is no distension. And now I palpate also. Okay, that's great. There is no masses and no tenderness. Do you have any pain?
No.
Okay, now I do the Morpheus sign, and I find the lever and I press under it, and I ask you, take a deep breath.
No.
Take a deep breath.
نفس عمیق.
نفس عمیق. Do you have any pain?
No.
Okay, she did it without any pain, and that was the good Morpheus sign. And for the rebound tenderness, I palpate and I take it. Did you feel any pain?
No.
Okay, that's great. So would you please sit down? Thank you. For the neuromuscular, for the neuromuscular, I start with the sensation. Okay, so this is dull and this is sharp. Close your eyes and tell me when it is dull and when it is sharp.
Dull, sharp. Dull, sharp. Dull, sharp. Dull, sharp.
Okay, and for the light, I just use a cotton ball, and when you feel it, just say now. When you feel it, close your eyes.
No. No.
Now.
No. No. No.
Okay.
No.
Okay, that's great. So this is up and this is down. Okay. When it is up, say up. When it is down, say down.
Down.
Close your eyes.
Up, down.
Very good.
Up, down.
Okay. For the stereognosis, I put something in your hand. Tell me what it is. Close your eyes. Close your eyes.
Pen.
Okay, that's great. So good. And for the deep tendon reflection, okay, I do the biceps. Just relax. Just relax. Just relax. No, you can
Yes.
close. Okay. No. It's okay. Triceps. Triceps. Okay. So brachioradialis. I see it. Okay, that's great. Now I do the patella. Okay. Okay. Achilles. Okay. Now Babinski. Okay, that's good. So the Babinski as well. Would you please stand up? Thank you. Would you please walk like this, heel to toe? Heel to toe. Thank you. Okay. Would you please walk on your toe? Toe. Would you please walk on your heel? On your heel. Okay. Would you please stop over there? Stop. Close your eyes. Close your eyes for 20 seconds. She closes her eyes, and that is the Romberg test. Okay, she can do it without losing her balance, and that is my video. Thank you so much.